It's often called the silent killer, ovarian cancer.
September is Ovarian Cancer Awareness Month. 13 News anchor Sandra Parker joins us again to tell us why awareness is so key for this disease.
You know, it really is, and that's because the symptoms of ovarian cancer often can be misdiagnosed for many digestive disorders, which means that most women are not diagnosed with it until they're in the latter stages, and the survival rate is great if it's caught early.
Charlotte Olson started noticing something wasn't right just before Easter 2009.
Well, I started excessive weight gain for no reason. I had very little appetite, and in a matter of about 5 days I had put on 20 pounds.
Her doctor told her she was suffering from severe constipation and gave her some medication, but the symptoms got worse, so she went to the emergency room. After a CAT scan, the doctor gave her the news.
Said that I had ovarian cancer. I mean, just boom.
It was stage 3. Within 48 hours, Dr. Michael McCullough was performing surgery to remove the cancer.
The doctor basically told me if it had been a couple of more months, I wouldn't be here.
And that's because many of the early indications of ovarian cancer, bloating, abdominal pain, or urinary problems, can be symptoms of other things.
By the time patients develop symptoms, they usually have pretty significant disease that has maybe filled the pelvis or extended into the abdomen, and unfortunately that's the norm.
Dr. McCullum says some things can reduce a woman's risk of getting ovarian cancer, like having multiple babies, breastfeeding, and using oral contraceptives.
And we have seen survival gradually extend. The cure rate has not improved, but the average life expectancy of the patients has become prolonged.
As for Charlotte,
I went through the initial chemo, and I was also on a clinical study for ovarian cancer, which I continued until June, and June 2nd I was re-diagnosed with a reoccurrence.
So she's back in chemotherapy, but still very optimistic about her future.
Every day is a challenge, but every day is also a gift.
And there is a lot of research going on right now to look for early markers that might help to determine if someone has ovarian cancer, but Dr. McCullum says that's still years off. Now, you can check out my story at WVEC.com for more signs and symptoms to look for with ovarian cancer.